When the arteries cannot supply enough blood to the heart, doctors may recommend a procedure known as coronary artery bypass graft surgery, often performed while the patient's heart is still beating. In this episode of Health Digest, I take you to the operating room where doctors are performing a surgery on a 57-year-old patient who presented with up to 4 blockages. Come with me. This cardiothoracic theatre is a beehive of activity. A team comprising of the lead cardiac surgeon, an anesthesiologist, alongside other critical cadre of healthcare professionals, kick off a critical heart surgery that requires utmost precision in execution. Armed with a brief of the surgery of the day, they all get down to work, carrying out a procedure that to an ordinary person would be considered impossible. But like science would have it, this is yet another great stride made in cardiac surgeries. With their sharp scalpels alongside other surgical tools, they meticulously cut through the patient's body to get access to the small yet vital organ in the human body, the heart.
1.25.
The surgery kicks off at exactly 9:59 in the morning. A bypass surgery known as beating heart surgery or the coronary artery bypass graft surgery. What is striking about this type of procedure, rather, is the fact that the patient's heart won't be stopped during the entire process, as always seen in some heart surgeries. Dr. Sunil Kumar Dubey is steering this procedure. He is also the head of cardiothoracic surgery at Medihill Hospital. The patient on the table came in with 4 blocked arteries that were affecting the supply of blood to some parts of her heart.
In this patient also, if you see what we have operated today, this patient was having, this is the right, the black sketch is of patient's own blood supply, heart blood supply, coronary arteries. This is right coronary arteries. This is left main coronary artery dividing into LAD and circumflex artery. Okay. So see, here is 95 to 99% block here, 90% block here, some 80 to 90% block here, 90% block here. The right one is having 80 to 90% block here. So because of this, the heart muscles, they are not getting blood supply. So what we have done is, we have taken a vessel from inside of the chest and we have attached it here. So because of blockage, the blood was not going, so that will go through this. So one we have attached here, so this will carry blood from aorta to this part of the heart. Now we have taken saphenous vein graft and we have attached to these branches and attached it to the aorta. So this will carry blood to this whole part of the heart. Then right side, there was 80 to 90% blocked, so we have put a vein graft from here to here, so this hole will be supplied by this vessel.
In this procedure, Dr. Dubey and his team aim to improve circulation to the affected heart muscles. To do this, they create a bypass. The grafted artery or vein bypasses the blocked parts of the coronary artery, carrying oxygen-rich blood to the heart muscle. The grafts can be harvested from different parts of the person's body, either from the legs, chest or hand.
God has given us double lane traffic where single lane traffic is needed. So everywhere He has given us ample amount of circulation. So in the chest, behind this rib cage, there are a vessel which is called internal mammary artery. So one on the left side, one on the right side. These two are called internal mammary arteries, IMA. So it is, one is left, lima, one is right, rima. So lima, rima. Then in the hand, we can take out radial artery. Which we take out the radial artery. The other artery which is on this side of the body, hand, it supplies the upper limb. So our hand is preserved. In the leg also there is saphenous vein graft, which we take great saphenous vein, which starts from the foot and it goes up to the groin. So we can take this vessel and we can use as a graft during the bypass surgery. Then our body has got different other veins also in the upper limb as well as lower limb, which make up for the loss, and they supply the affected area.
So the doctors have successfully harvested healthy blood vessels from the patient's legs that will be grafted to the blocked coronary artery. At the same time, they've divided the chest bone going through the middle of the sternum to get access to the heart. The heart surgeon explains that the remaining blood vessels often make up for the harvested ones and supply blood to the affected areas through their tributaries. There are two types of coronary artery bypass surgery, also abbreviated as CABG. The off-pump bypass surgery and the minimal invasive bypass surgery. The off-pump surgery is also known as the beating heart surgery, where the patient's circulatory system remains intact and is not connected to a cardiopulmonary bypass pump or heart-lung machine that performs the function of the heart and lungs. The success rate of beating heart surgery surpasses 90%, with only a risk of 2 to 3%. During this procedure, the heart is not stopped while the surgeons suture the grafts in place. Dr. Dubey gives it an upper hand in terms of preference by cardiologists when treating blocked heart arteries. Doctors say stopping the patient's heart while performing a bypass surgery has its own demerits. A patient may only be connected to the heart-lung machine when their heartbeat is pumping too low. This can be due to a prolonged heart disease, which makes the surgery a high-risk one. Most patients like the one Dr. Dubey and his team are operating on are eligible for beating heart surgery. However, if they have an underlying condition which is too actively involving the heart, or just had a recent attack, or those with an accumulation of calcium in the arteries are not eligible for the beating heart surgery, but rather the surgery that requires their heart to be stopped and are connected to the heart-lung machine.
Traditionally, we have been doing this kind of surgeries by putting the heart, taking the blood to a machine which is called heart-lung bypass machine, then stopping the heartbeat, and then we operate these patients. But because this is an artificial machine, and the function of heart and lung to be taken care by an artificial machine, so there are certain disadvantages of that. So avoid, just example is in chances of infection, then that inflammation can occur in the whole body, there may be bleeding, there may be risk of paralysis also to a patient, which is called stroke, and some kidney problems in such kind of patients. So to avoid this, gradually with the evolution of technique, now we are doing beating heart surgeries, in which we do the same surgery, but without the heart to stop the beating.
With the beating heart surgery, there is less handling of the aorta, less chances of stroke, less bleeding, and chances of infection. The duration of stay in the intensive care unit ICU and the ward is also shortened. The duration of the surgery is not pegged on the condition the patient presents with, but the surgery. Doctors say the human body is created in a way that where only one blood vessel would be required to perform a function, it is rewarded with an extra blood vessel in the same area, which is considered a bonus. Even if they are 50 or 60% blocked, the body adjusts. However, with time, the blockage increases and the person may experience pain on exhaustion, emotional disturbance when they are performing certain tasks like running or climbing a flight of stairs.
Usually the patient come with the complaint of chest pain or breathlessness on exertion. As we walk, the heartbeat increases. The demand of the heart muscles increases, but because of blockages, the heart is not able to get proper blood supply. So when the person walks, climbs stairs, or when he is emotionally disturbed, so that time he starts having pain either in the center of the chest or it is radiating to the left shoulder or left upper limb. Sometimes it is in the jaws, sometimes in the neck, and sometimes in the back. So there may be pain in the chest pain. There is dyspnea, breathlessness on exertion. some people, especially there may be palpitation, what we call as abnormal feeling of the heartbeat, whether it may become a bit high or even sometimes low because of heart attack. And some patients, like especially in the diabetes, the pain sensation which is taken by the nerves to the brain, they are damaged. In what our language we call it as autonomic neuropathy. So in diabetes patients, even 50 to 60% of these, they present with burning behind the sternum, just more of acidity kind of thing, because their heart is not able to give the brain signals of chest pain. So they have sort of burning sensation.
These blockages are caused by two factors which may be modifiable or non-modifiable. The non-modifiable are factors beyond human control, and they may include genetics, age and gender.
There are certain modifiable factors also. Just like if somebody is not having proper diet rich in high fatty food, cholesterol level, this has to be checked. Diabetes has to be controlled, blood pressure needs to be controlled, and sedentary lifestyle has to be changed. They have to do regular exercises, and also the person has to stop smoking. So these are all the modifiable factors which we can which help in such kind of patients.
On the other side of the hospital, some patients like Firoz Abdul Razak, a resident of Nairobi, was preparing to go home. The 46-year-old has been at the facility for the past 14 days, 3 among them having been spent in the intensive care unit after undergoing a beating heart surgery. Abdul Razak had up to 5 blockages in his coronary arteries. An early onset of stroke saw him rush to the hospital for further checkup when his symptoms could not be managed through the self-medication he had immersed himself in. His surgery took about 7 hours.
Wiki mbili iliyopita nikatoka kazini, ilikuwa Tuesday, Wednesday. Before that nikasikia kama mwili haiko vizuri. Nalikuwa nikijilazimisha ile paracetamol kidogo, kuna gas nini. Sasa Wednesday night kutoka kazi nikaingia asubuhi kuamka last 2 weeks ago. Asubuhi 1:30 nikasikia kama hii kitu kinakufa ngazi. Nikasikia kitu kimekwama hapa ndani. Siwezi kutauka. Nikamwambia bibi yangu, this is not a normal thing.
He attributes his health predicament to the soothing but lethal puffs of the cigarettes he smoked, only to realize that just like the fast disappearing smoke from those cigarettes, he was slowly exhaling his health away.
Amesema 90% ni sigara. Sababu hiyo nicotine ina block your veins. Kivuta inaingia direct. Calculate my years, I'm smoking since 30 years. 1, 2, 3 sigara 4 pia 5 ya siku. The nicotine goes inside every day. Kama munavuta, mujaribu kuacha hiyo kitu. Baadaye ndio mutasikia utamu yake na ubaya yake. Sababu watu waelewe. Unajua mimi pia nilikuwa sielewi, lakini sasa nilipochapa hiyo kiboko nikaambiwa haya ndio hii kila kitu. Sasa ndio nikasema mimi mambo za masigara na hizo weka kando. Nimepata my new life.
His recovery back at home also comes with some instructions like
not to put any load on your chest, and this I should wear around 3 months to recover my chest, because if I cough I will feel a pain because they have done open surgery. Whatever I feel, they have taught me how to do it.
he will also have to use this incentive spirometer to exercise his lungs and make them stronger as he heals from the surgery.
after the surgery, they need to do good physiotherapy, because otherwise the lungs will not inflate properly. They will, there is a space between the lungs and our rib cage. So if they are not doing proper physiotherapy, their lungs are not inflated. So in such patients, there may be collection inside, and it may need again to be drained out. Okay, their lung, if there is not inflated, there will be possibility of developing lung infection or even pneumonia. Okay, so that is why a good physiotherapy is must. What we call as incentive spirometry, which helps in like keeping the lungs also normal. Otherwise, if they develop lung infection, they develop cough, cold, and this will cause further increase in the chest pressure, and every time they will cough, this bone will move and they will have more pain. Okay, so for all these reasons, they need to do good amount of physiotherapy and spirometry, or the chest physiotherapy.
His counterpart Stephen Rito, who also underwent the surgery, will also not be spending the night at the facility after successfully undergoing the beating heart surgery. Before the doctors nailed a diagnosis, he had been treated for other conditions since 2014.
Walikuwa wananitibu pylori, kichwa, mpaka ikapigia kupewa mandawa hata ya pressure. Sasa kichwa ndio ilikuwa ikigonjeka sana, na nikifanya kazi ngumu nasikia kwa upande wa moyo uko na ushungu mwingi. Wakati najaribu kufanya kitu unafanya kwa haraka.
The surgery seems to have resolved the migraines he would experience, he tells me. He regrets not being able to adjust his health-seeking behavior.
Mimi kulingana na vile nilikuwa nikifanya kazi na nikiwa mgonjwa hivyo, watu ni wagonjwa, inafaa washughulikiwe, juu unaweza kuwa na hiyo tatizo na ujui sababu sio kitu unasikia, ni mambo tu yanakuja. Unasikia leo uko hivi, kitu inaweza kuja usikie usungu mwingi na ukuisha. Hata unaweza enda kwa daktari kabla hujamuelezea vile ulikuwa unasikia hata ujui mueleze nini, unatoka unaenda.
There are different tests that are conducted to help diagnose those blockages, as explained by Dr. Dubey.
We do the ECG of the person, we do echocardiography, that is the sonography of the heart, and if there is some problem in that, then we have to go ahead with the angiography of the heart, in which we put some dye, radio opaque dye in the heart vessels, and we make a X-ray kind of film, continuous film, in which we see if there are blockages. If these blockages are at 1 or 2 points where we can put stents from inside, then our dear cardiologist friends, they do angioplasty. That is, they put a small stent or spring from inside the blood vessel and they open it there. But if these vessels are diffusely diseased, that blockages are at certain points where this angioplasty is not possible, then we go ahead with the bypass surgery. Okay. So after the surgery is over, we close or approximate this bone with the help of steel wires. Okay, so we tighten it. So the fracture is there, but with the help of steel wires, it is now near each other, approximated. For this fracture to heal, it takes time, at least 6 to 8 weeks. For that time, then we cannot put a plaster here. If somebody is having fracture in the upper limb or the lower limb, we put a POP cast, what is called plaster cast. Okay, but in chest, we cannot put a plaster cast. The person has to breathe. So we apply a chest binder or sternal binder, and it is tightly put so that this bone does not move every time. Okay, so it helps in keeping this thing together, and it avoids movement of the sternum. Too much of pain is avoided because it keeps them together. We explain to the patients that after the surgery, they have to be, for 2 or 3 days, they will be in the ICU, another 2 or 3 days, they will be in the wards. So routine things, what we will be doing before the surgery, we will give them anesthesia, or anesthetist friend, they give them anesthesia so that they sleep. In the deep sleep, they will not have any pain, They will not be afraid, there will not be psychological stress. So then we do the surgery, and after the surgery, when they are in ICU, we see everything is fine, then we make them conscious again. We give them medicine so they become conscious. And usually after the surgery is over, after 2 to 4 hours, we remove this ventilator machine. Patient is fully conscious and they can talk to their families. And usually it is nearly 3 to 4 hours post-operative, but in some patients they may need ventilator support for overnight period also.
Cardiovascular diseases are on the rise globally, and experts are calling for urgent action to help stop and reverse the steep rise in heart failure happening across the Middle East and Africa. A group of experts from the region explained that the average age a person will develop heart failure in the two regions is 53 and 56 years respectively. Unmet needs in awareness, prevention and diagnosis of heart failures have been highlighted as major barriers to prevention of heart failure in the region.
Everybody is having too much stress in their life. So all these things, they are eating junk food, okay. The tummy is more, but their limbs, they are thin, which is called pot-bellied people. You can see them more than what we used to see previously. Okay, so these all things which are to be avoided. Stress is a very bad thing. Even stress can cause brain hemorrhages. Stress can cause increase in the heart rate, increase in the blood pressure. Stress can cause even blockages which are already there in the heart vessels. It can cause unstabilization of the plaques and acute onset of heart attack also in some patients. So anxiety and stress, they are very bad factors. They cause a release of certain hormones which are not good for our body. So that's why all these things need to be avoided. You see, the message behind is prevention is always better than cure. So if we can, if somebody is already having a genetic predisposition, if their father, mother and brother, sister, they are already having heart diseases, it is better to take certain precautions. Do not eat junk food, smoking, avoid smoking, take care of your blood pressure, diabetes, avoid sedentary life, right? So avoid junk food. So these things, they will keep the persons happy and healthy. So if it is possible, prevention is better.
To reduce this burden, policymakers have also been challenged to prioritize heart failure and its associated comorbidities, train health workers in early detection of high-risk patients, improve access to advanced diagnostics, among other recommendations. Gloria Milimu, KTN News.